Nearly 3,800 new positive cases of the coronavirus. That is a record-breaking daily spike in Maryland. The statewide positivity rate is now at 8%. 21 more people went to the hospital for treatment. 24 more people have died. Hello again, I'm Lynn Bowie.
And I'm Tim Williams. Doctors across Maryland are treating nearly 1,600 COVID patients in hospitals across the state. Almost a quarter of those patients are in an intensive care unit. Now, this morning, Governor Larry Hogan tweeted out saying the promise of a vaccine has given us a light at the end of the tunnel, but we still have dark days ahead. He urges everyone to avoid gatherings, wear a mask, and wash your hands.
Baltimore City Mayor-elect Brandon Scott is in quarantine right now after possible exposure to COVID-19. He says he is not experiencing any symptoms. Also, he tested negative twice since Saturday, but he is still consulting with the health department. And out of an abundance of caution, he is isolating himself.
I think this is something that is critical for folks to understand, that we have to follow public health advice.
Scott released a statement saying a Baltimore City Department of Public Works employee has passed away from COVID-19.
He says, in part, we mourn the loss of Charles Johnson. Johnson spent the last 45 years serving the people of Baltimore, ensuring the water we use daily was clean and safe. More than 276,000 Americans have now died from the coronavirus.
According to new data, that number could nearly double by April, and we could see 500,000 deaths. The Institute for Health Metrics and Evaluation suggests daily deaths will peak in the range of 3,000 by the middle of January. The new model covers primarily the period before vaccines are expected to be widely available to the public. Researchers estimate more than 66,000 American lives could be saved if everyone wore a mask.
Meanwhile, it is important to remember that many people do survive after testing positive for the coronavirus, and to date, more than 5 million Americans have recovered from COVID-19.